Hi, I'm Dr. Theresa Oswald, and today I'd like to tell you about my specialty, which is called Physiatry. And you may say, what on earth is Physiatry? It's not uncommon for my patients or their families to look it up on Google to see what the specialty is, because the name doesn't say in itself, self-evidently, what the specialty is. So another word for physiatry, another term, is called physical medicine and rehabilitation. And I think that term tells about the history and also the reasons why this specialty exists. So physical medicine really started in around 1938 by a doctor named Frank Croizon, and he was a patient himself. He had, at that time, he had tuberculosis, which was common in the 1930s, unfortunately, and he realized that the things that they were offering him to treat his own illness, reliance on medication, he felt was really missing the full gamut of things that might help with healing. And so he looked at using what we call physical modalities or physical medicine, which are things like heat, ice, electrical current, massage, movement, stretching, all of those things in combination with medicines to get a more full treatment plan. And then separate from Dr. Croizon was another doctor in the early 1940s, Dr. Howard Rusk. And he was treating corpsmen, Air Corpsmen in World War II that were coming back with injuries. He was a surgeon in the Air Corps, and he noticed that having the pilots or the airmen stay in bed rest for long periods of time was not helping their recovery. And that once they were initially stabilized, he realized that exercise and movement was going to improve their outcomes and their function more than bed rest. And then there was a kind of combination of those two fields, and it became an accepted term, physical medicine and rehab, or physiatry. In the mid-1940s, the AMA noted this as a specialty. So why am I so passionate about this specialty, and what's its unique qualities? Well, one of the main things that I love about this field is, although it's a specialty, so I'm not a primary care physician, but I do treat the whole person. So it's a holistic specialty. So other specialties tend to focus on a particular organ system in the body, like a cardiologist focuses on your heart, or a nephrologist focuses on your kidneys. But a physiatrist focuses on function. We look at everything that's going on with your body, your support systems, your emotions, your family issues, financial issues, anything that would impact your recovery and get you back to a level of function that you've had before an injury or an illness. So the holistic aspect of physiatry is very appealing to me. The other thing is that we focus on function. We're not trying to necessarily get rid of a certain symptom. We're working on having the symptom be managed. It can improve, but regardless of whether the symptom is there or is persistent, it's getting better, we're working on improving your function. And then, hopefully as the symptoms get better, such as pain or weakness, then you can get back to your activities that you normally do. The next thing is that we really focus on exercise and movement. So oftentimes we work in partnership with other disciplines in the medical field, usually physical therapists and occupational therapists, also speech therapists, rehabilitation nurses, and social workers. But most people end up getting some sort of a physical movement plan that works on the four main components of exercise: aerobic activity, stretching, strengthening, and balance. And the other intriguing thing about physiatry is that as a field, we really like people to be eventually able to self-manage their problem. So we give them home exercise programs so that they're not reliant on coming back to get treatments in order to stay well, but they're given the tools to guide their own healing and maintain their own wellness. So that's my sales pitch for physiatry. It's a wonderful specialty with really poor name recognition, but it really is something really important to people who are looking to either improve their function or maintain their function. One group I can think of that comes to mind is the baby boomers, which I am a part of. And as we get older, we want to be able to do the things that bring meaning to our life. And so seeing a physiatrist or a physical medicine and rehab doctor, if things that you like to do are now getting difficult, there may be very many solutions that can be discussed and then implemented into a program that you would then carry on yourself. So thanks for watching. More about the benefits of physiatry and other healing strategies.